So yes, this is my presentation, and I've decided to talk about a gene because I'm interested in neurogenetics, and the gene that I've chosen to talk about is c9ORF72. So this is not a gene in itself really as a genetic mutation, a type of mutation that was discovered in 2011, and it's a hexanucleotide repeat expansion. So unlike other repeat expansions that are usually trinucleotides, this is 6 bases, so it's 4 Gs and 2 Cs. And it's intronic, so it's not in an exon, not in a coding region of the genetic code. Intron 1 or chromosome 9 in open reading frame 72, which explains the terminology of the C9 open reading frame ORF72. And I've just got a couple of pictures here to show you what happens with the expansion. So on the top image, most people have about 2 copies or two copies of this 6-base sequence, which you can see in this first peak in the top image. And then on the second allele, it's quite common to either have 2 again or to have a small number of repeats. And in this case, it's 8 in the second peak. And the reason that you can have 8 is because repeat areas, so repetition of the G and the C, is quite unstable, so it's quite common for there to be duplications. However, in the second image, you can see that there is a peak round about 2, which is just right at the start of the chart, and then there is this kind of peak round about 3, 4, and then it sort of fizzles out, and that's indicating that there is basically you're able to kind of read off that there is expansion of this hexanucleotide repeat, and you can see there's still peaks around about 30, 35, but actually beyond that as well. And anything beyond 30 repeats is considered pathogenic, but actually in reality, most people with a pathogenic mutation have repeats in the thousands. So the clinical significance of this is that it is found in quite a few neurodegenerative diseases, most commonly in motor neuron disease, the ALS type, but also in frontotemporal dementia. But it also can be seen as manifesting as Parkinsonism, Alzheimer's disease, and also a phenotype that looks like Huntington's disease, and we call that a Huntington's phenocopy. So it's not the Huntington's mutation, but it's something that looks like Huntington's caused by C9orf. In MND, it's present in 9% of all MND cases. It's the most common MND-associated gene mutation, and actually 32% of familial cases and 6% of apparently sporadic cases. So it is very important. It's got about 50% penetrance, so there's 50% chance of it being passed on to other members of the family. Associated with cognitive impairment, dementia, and in some cases psychosis. And it's also a poor prognostic feature. So if someone has MND with associated cognitive impairment, then it's worth testing because it will give you information about their prognosis. And it's tested through Edinburgh Genetics, and it's the neurodegenerative disease gene panel that you would request. So what's the kind of future of c9ORF72 and why are we interested in it? Obviously, it has prognostic implications, but actually, now that we have identified this gene mutation, it's a possible therapeutic target for future drugs for ALS and other diseases. And this image on the left just summarizes the proposed pathophysiology of this mutation. With this expansion, the gene sequence does not work properly, so there's thought to be a loss of function element to it, but actually the target is mainly to do with the gain of function toxic elements to it. So there's RNA toxicity and what they call dipeptide repeats, which are essentially small molecules that accumulate and cause a toxic environment to the cellular environment. And there is an ongoing clinical trial, the first in man treatment trial for c9ORF72 associated mutations in ALS, and is an antisense oligonucleotide, which is similar to the SMA trials. And it's based on quite extensive studies that have been done in mouse models and in induced pluripotent stem cell models to try and reduce the toxic gain of function effects of c9ORF72. So hopefully this is something that will provide some hope and treatment for MND patients in the future.